Kirby, thank you so much for joining us today. Your wonderful former boss, Dinah Jeffries, appeared on the very first episode of Public Health Chat, and I want to congratulate you on being named Emergency Services Director. Here in Orange County, we are lucky to have excellent collaboration between departments. In particular, emergency services and the health department have been close partners during the pandemic. Can you tell me how emergency services and health have collaborated to open vaccination sites in Orange County?
Well, thanks, Kristen, for those warm welcome, and I appreciate the sentiment and welcome as Emergency Services Director. The health department and emergency services really enjoy a fantastic relationship and have been for well before the pandemic arose. We have really been engaged with one another more intimately for over a year now. January 25th was our 1 year marking the start of beginning COVID response, and engaged in those early days. It seems like a long time ago, was trying to gather information and prepare us to get us to where we are right now, where we're actually vaccinating to hopefully bring an end to the pandemic. So all in all, we feel like we're in unified effort and have been from the very beginning of this pandemic, which is a very fortunate position for both us and the health department, as well as our community.
So Kirby, I know that finding qualified personnel to administer the COVID-19 vaccine has been a challenge in many counties. Can you tell me how Orange County worked in advance of the arrival of the vaccines to head off this problem at the pass?
Certainly, yeah. So we have some very smart and creative individuals in both of our agencies and departments, in the health department and emergency services. We're fortunate to have very knowledgeable and energetic individuals in both departments that really are progressive in how we prepare and how we responded to this pandemic from the beginning. Specifically about vaccinations, we were started well before we even had a COVID vaccine. Back in the fall, we recognized what was on the horizon, and our staff did, to determine that when we get vaccines, we are likely to have a challenge with having enough vaccinators to administer the vaccine. We were hopeful, and I think we are still hopeful, that there will come a day when we have far more vaccines than we have the ability to administer. That is not the case right now, of course. We have a lot of community support and a lot of personnel to administer the vaccines. Unfortunately, the vaccine still remains in limited supply, as Quintana mentioned. But specifically, how do we prepare? We began in the fall with first looking at who could administer vaccines. And so our medical director, Dr. Joey Grover, looked deeper into that issue and was able to advocate for EMTs, or emergency medical technicians, for their ability to administer vaccines. At that point in the fall, it was not in their scope of practice to administer vaccines. So it required some changes at a state level on the policy side, and we were able to achieve that. As somewhat of a trial run and to get us prepared for the COVID vaccine, we started working closely with our health department partners to administer the flu vaccine, and to become responders in getting flu vaccinations out in the fall. And that put us in a really good position to have qualified, competent, and prepared EMT basics to administer the COVID vaccine. To date, our EMTs is not just emergency services EMTs, but it is EMTs within our volunteer fire departments and throughout the community, have been really instrumental in the effort thus far to administer vaccines to the Orange County community. And that is something that we take great pride in, and it's no easy feat to have changed policy guidance at a state level to even at a local level incorporating EMTs who are volunteers within our community. And so in some ways it's like the community vaccinating itself, which is very an awesome sight to see. And so we would not be where we are today without those efforts. And I think about 45% of staff administering vaccines have been EMTs or paramedics thus far. So a very large number of vaccines that have been administered in our community have been administered by EMTs and paramedics from across the emergency services system, not just Orange County Emergency Services, but again, the Volunteer Fire Department, South Orange Rescue Squad, and emergency services all collaborating together, which is really exactly how we responded. this whole last year as one community. COVID has impacted the whole community. It has taken the whole community to respond, and it is still taking the whole community to close out and bring this pandemic to an end. So.
Wonderful, thank you. So Kuntana, what has been your experience working with emergency services to get shots in the arms of Orange County community members?
Well, Kristen, I would say our partnership with emergency services has been wonderful, even before the start of the pandemic. The transition with directors has been seamless, and we just couldn't do this without their help. I mean, frankly, whenever we show up and we're on site at a pod for the vaccinations, we will be dead in the water without our partnership with EM. So I would say, in addition to them helping to put the shots in the actual arms, they are really our backbone with the pod setup and logistics and helping us with staffing. And I mean, hey, Kirby even, laid down and helped design our pod flow and the traffic plan. And so it has been a wonderful partnership. And I am just very happy and excited to have Kirby named as our emergency services director. And, we joke, I feel like I start the day with Kirby and I end the day with Kirby. But it's just our constant open lines of communication, and it's appreciated. And again, I don't know where we would be without their partnership.